Hello everyone, welcome to my channel again. My name is Bolake. I'm a registered nurse and I've worked in capacity of a registered midwife for 5 years. And today I will be talking about pain management in labor. Don't go away. Let's dive into the topic together. Welcome back to my channel again. I will be talking about pain management during labor. Even though pain is a good stressor in labor, it initiates the starting of labor because of the compression of the presenting part on the mother pelvic bone. This sends a mental note that labor has commenced. So some women describe this as menstrual pain initially, which radiates from the lower abdomen to their back. This sends a signal to the brain that labor has commenced. Labor pain can be perceived differently from one woman to another, from different culture and ethnic group, but pain is pain irrespective of color, irrespective of any ethnic group. But in order for a woman to have a positive birth experience as an healthcare provider, midwife, obstetric and gynecology, we must able to support women during labor for them to have a positive experience. There are different ways of managing labor pain, which can be medically, giving of medication on and non-medical pain management in labor. First of all, I'm going to talk about non-medical ways in managing labor pain. Number one is a woman should psychologically and emotionally prepare themselves for labor, because in the past I've worked in a capacity of a registered midwife for like 5 years. Have observed that in some women that I notice or that I've dealt with even before labor commence in them, and I see that they have low threshold for pain. But surprisingly, they will be able to cope with labor pain perfectly. And this prompts me to ask them questions because I know them, and I will ask them. I see then that they are able to cope with this labor pain very well. And some of the answer is that they've already made up their mind that they are going to put this labor pain in check. This is an emotional preparedness. They actually have it in their mind that they are going to put it in check, and these has worked perfectly for this set of women. Another thing is through music therapy. In the earlier stage of labor, music therapy is helpful. It can make a woman to relax, and this relieve them of pain during earlier stage of labor, because nature plays it in such a way that it gradually that labor pain increases. In the initial stage, at the first stage of labor, it can be perceived as menstrual pain in some women, because labor pain increase gradually from mild contraction to moderate contraction and a strong contraction. And God did it in a way that is only when a woman is moving closely to the second stage of labor, that is when they are going to have strong contraction and a bit intense pain. So in the earlier stage before the intense pain, a woman can use a music therapy to relax themselves and relieve themselves of pain. Their, their choice of music, you can go with your earpiece and enjoy your music. You can move around, change position unless if it's otherwise advised by the healthcare provider, midwife monitoring you during that period as a result of anything else that come up like premature rupture of membrane. Having a support is in labor is essential to relieve pain. Studies shown that women that have support people around during their labor has reduced duration of labor and also have a positive birth experience, reduce medicated labor as well. So it's essential to have a support during labor, but you have to find out ahead of the labor if the facility you are delivering your baby actually support having someone with you during labor, most especially during the second stage of labor. Some facility can allow spouse to stay with their wife during even during the second stage of labor. Ahead of this time, the facility will discuss what the support person present during the woman labor can actually do. Maybe they are just to support the woman when the woman is changing position during labor or when the woman is moving around as at earlier stage of labor, and to even encourage her with words, praise her that she is doing a worthwhile job. These are very important and these have a very positive effect on labor. Going on to medicated ways of relieving pain during labor. Opioid drug can be given in labor to relieve pain in women, and it's advisable not to be given when the woman is close to the second stage of labor. And the woman that receive an opioid drug have to be monitored closely, especially the respiratory rate has to be monitored very well. And it can also cause a sedative effect on the woman as well, and it can also have effect on the baby respiratory as well. The woman that receive an opioid during labor have to be monitored closely. And if the need be after the delivery of the baby can be given a drug to knock off the effect of the drug after the delivery. This is important.
Another way to relieve labor pain is through the use of nitrous oxide, which the woman can inhale with face mask. And with this, the woman is able to control how she uses the face mask. And immediately she removes the face mask, she's going to be relieved from the effects of the drug. This is available in some part of world.
Epidural can also be given to relieve pain during labor. They are going to introduce a catheter into the epidural area of the spine to introduce an anesthesia drug in order to relieve pain and knock off pain from the umbilical area downward. And the amount of anesthesia that is given can be controlled. And it's also advisable when the woman is moving towards the second stage of labor that the dosage of anesthesia should be modified, reduce the dosage given so that the woman can have an urge to bear down during the second stage of labor, because epidural can actually reduce pain or knock out pain totally. When the pain is knocked out totally during the second stage of labor, it can increase forceps delivery. The woman will not feel an urge. if the pain is totally knocked off at the second stage of labor. So it's important for the anesthetist that is given this drug to actually measure the way the drug is going to be given when the woman is close to the second stage of labor to reduce vacuum or forceps delivery. This is essential. And the woman have to be monitored very well, especially the blood pressure of the woman have to be monitored very well because epidural can actually reduce blood pressure, and a woman receiving epidural during labor can actually have a fluid therapy during labor as well. Epidural is mostly used in different parts of the world in our advanced world, and it's also accessible in Nigeria. The thing is for you to discuss this with your healthcare provider. If the facility are going to have a personnel that is specialized in that regard to be present during your labor. Epidural does not affect the outcome of the labor, whether the woman is going to deliver naturally, whether the woman is going to deliver naturally, or whether the woman is going to deliver by CS. It doesn't affect the outcome. It's relieve the pain. And the thing is easier for a woman to actually cope with pain very well. And the pain can be knocked off totally by the use of epidural. So I've come to the end of this video. I've talked about different ways of relieving pains during labor. If a woman have a reduced pain during labor, the woman tends to have a positive birth outcome, which is very important. So as a pregnant woman, expectant mother, you can actually make your choice among all these methods of relieving pain during labor. I know you are strong and you can do this. So, and I pray that every pregnant woman watching me now, the Lord will give you strength to deliver like the Hebrew women. Save motherhood. I wish you an healthy babies to healthy families and healthy women. Bye for now and take charge of your health.